We owe a lot to our bones and joints. They give our body structure and support us and allow our movement. This is why bone and joint pain can severely affect a person's lifestyle. Not only that, but to add insult to injury, most of the medications out there to relieve this pain have negative effects on different organs in the body, especially the liver and kidneys. This is why in this video, we will reveal to you the top 10 natural remedies for bone and joint pain. You'll be amazed by the effectiveness of these remedies. So without further ado, let's get started. Number 1. Boswellia. Boswellia is also known as Indian frankincense. The compounds responsible for its actions are boswellic acids. A study was done in 2013 to see the efficacy of Boswellia extract in treating osteoarthritis of the knee. 30 patients received 333 milligrams of Boswellia extract 3 times daily for about 2 months. The results showed an obvious diminishment in knee pain, improvement in knee flexion, and increased walking distance compared to the placebo group. You may think that this is sorcery, but other studies scientifically explain this. Boswellic acids inhibit 5-lipoxygenase enzyme. 5-lipoxygenase is an enzyme involved in the synthesis of leukotrienes. Leukotrienes are inflammatory compounds that play a role in chronic inflammation in conditions like arthritis. Boswellia can be used as topical creams. They can be applied directly to the skin for localized pain relief, or 300 to 500 milligrams of Boswellia extract supplements can be taken 2 to 3 times daily. Number 2. Epsom salt baths. Epsom salt is the common name for magnesium sulfate. It is made up of magnesium, sulfur, and oxygen. It got its name from the town of Epsom in England, where it was initially discovered in its natural springs. When it's dissolved in water, Epsom salt liberates magnesium and sulfate ions. These ions can be absorbed through the skin. This is called transdermal absorption. The anti-inflammatory properties of magnesium and sulfur can aid in decreasing joint pain and stiffness in diseases such as osteoarthritis and rheumatoid arthritis. All you need to do is fill your bathtub with warm water and add 2 cups of Epsom salt to the water, then stir. Soak in the bath for 15 to 20 minutes to give time for the ions to be absorbed via your skin. You can repeat this 2 to 3 times per week, as Epsom salt baths are safe for most people except for pregnant women and those with kidney diseases. Number 3. Capsaicin. Even though not everyone can tolerate the hot taste of chili pepper, those who can are in great luck because chili pepper can ease the pain of your bones and joints. Both its hot taste and medical benefits are due to the compound capsaicin found in chili peppers. A study done to evaluate the efficacy of topical capsaicin in osteoarthritis showed that applying capsaicin cream to joints 4 times daily for 4 weeks significantly reduced the degree of pain in the capsaicin group compared to the placebo group. This is because capsaicin reduces the sensitivity of your nerves to pain. Capsaicin can be found in pharmacies in the form of creams or patches. Number 4. Willow Bark. The uses of willow bark go back to the Egyptians and Greeks for its pain-relieving and anti-inflammatory properties. This is why it can help inflammatory bone and joint conditions. The compound responsible for these merits is salicin. Salicin is converted to salicylic acid in the body. Salicylic acid, derived from salicin, inhibits cyclooxygenase 1 and 2 enzymes, which are both involved in prostaglandins production. Prostaglandins are compounds that cause inflammation and pain. Decreasing them decreases pain and inflammation of bones and joints. Willow bark extract has also been shown to lessen the amount of pro-inflammatory compounds called cytokines, further adding to its anti-inflammatory effects. You can obtain these benefits via tablets or capsules with 120 to 240 milligrams of salicin daily, divided into 2 or 3 doses. Number 5. Glucosamine and Chondroitin. Glucosamine and chondroitin are naturally found in your body in cartilage. Cartilage is the tissue that cushions your joints and prevents bone friction when you move your joints. A study published in Annals of the Rheumatic Diseases in 2010 had patients having knee osteoarthritis receive either glucosamine sulfate, chondroitin sulfate, or both in combination. After 2 years, the combination therapy showed a reduction in joint space narrowing, suggesting a protective effect on cartilage. The space in the joint would narrow if a disease occurred that would cause the cartilage to be inflamed and swell. Inflamed cartilage would cause pain and limit mobility. Taking glucosamine and chondroitin supplements would prevent and even reverse this inflammation. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 6. Omega-3 fatty acids. When most people hear fatty acids, they think they're bad for you. But contrary to widely held belief, omega-3 fatty acids are actually more beneficial than most people think, especially when it comes to your bones and joints. Omega-3 fatty acids are vital for human health. They are also known as essential fatty acids since the body can't synthesize them. So the only way to get them is through diet. Examples of omega-3 fatty acids are EPA, which is found in fatty fish, and fish oil supplements, DHA, which is also found in fatty fish oil supplements, and algae oil, and finally, ALA, which is found in plant sources such as flaxseed, chia seeds, hemp seeds, and walnuts. Patients of osteoarthritis and rheumatoid arthritis can benefit greatly from omega-3 fatty acids. This is because omega-3s decrease inflammation, and so they decrease joint pain and stiffness. They even decrease the need for taking anti-inflammatory medications as they alleviate the symptoms. In addition to that, they help in regulating your immune system and decrease the formation of inflammatory compounds. But how can omega-3 fatty acids have that much power inside your body? Well, they are precursors to eicosanoids, meaning that your body uses them to form eicosanoids. Eicosanoids are responsible for the anti-inflammatory effects. This is why it is essential to consume a handful of nuts per day and at least 2 portions or 140 grams of fish per week. Number 7. Hot and cold therapy. Hot and cold therapy is done by applying heat or cold to affected areas to alleviate symptoms of pain. Firstly, heat therapy widens your blood vessels. This increases blood flow to the affected area and delivers more oxygen and nutrients, while removing waste products and inflammatory mediators. The removal of these harmful substances reduces inflammation. Heat therapy is also known for relaxing the muscles surrounding the joints. By relaxing muscles and increasing blood flow, heat therapy improves joint flexibility and range of motion, making movement easier and less painful. Now, what about cold therapy? Well, cold temporarily numbs nerve endings, reducing pain perception and providing immediate pain relief. It also decreases joint damage and minimizes the production of inflammatory substances. Combining both therapies is recommended for maximum benefit. Disposable hot and cold packs can be obtained from pharmacies. Make sure to always use a cloth or towel between the skin and hot or cold packs to prevent skin burns or frostbite. Both therapies can be applied for 15 to 20 minutes. Number 8. Turmeric. Turmeric comes from a plant from the ginger family. 2 to 8% of turmeric is composed of the active compound curcumin, which is the reason for turmeric's vibrant yellow color and most of its medicinal uses. According to studies, turmeric can help relieve bone and joint pain thanks to its anti-inflammatory and antioxidant properties. Curcumin decreases the production of pro-inflammatory cytokines, such as tissue necrosis factor alpha, interleukin-1, interleukin-6, and interleukin-8. Cytokines are molecules that regulate the functions of your immune system. Remember that your immune system plays a role in the inflammation of your bones and joints. These specific cytokines are involved in the inflammatory process, and reducing their levels can alleviate inflammation. Moreover, curcumin strengthens the activity of antioxidant enzymes inside your cells. These enzymes break down oxidative substances called free radicals that can damage cells in your bones and joints, leading to pain. Some examples of enzymes that curcumin strengthens are superoxide dismutase, catalase, and glutathione peroxidase. Furthermore, curcumin itself neutralizes free radicals, which further prevents oxidative stress. A 2016 study found that curcumin significantly decreases pain and enhances physical function in osteoarthritis patients. You can incorporate turmeric into your diet as a spice by adding it to dishes such as rice or chicken, or you can take it as a supplement. Number 9. Acupuncture. Acupuncture is a traditional Chinese medicine practice where thin needles are inserted in certain points on the body to relieve pain, including that of bones and joints. It's incredibly effective in pain relief because it causes the production of endorphins, which are the body's own painkillers. Acupuncture additionally decreases inflammation by regulating the release of pro-inflammatory cytokines and stimulating the production of anti-inflammatory substances. Make sure to get acupuncture done by a qualified and experienced practitioner using sterile needles. Number 10. Ginger. Whether you like your ginger raw or cooked in meals, it will still in all cases alleviate your bone and joint pain. Gingerols and shogols are the main bioactive compounds in ginger. Gingerols represent the greater percentage and give fresh ginger its unique flavor and medical properties. Shogols are formed when ginger is dried or cooked and have strong anti-inflammatory and antioxidant effects. Like curcumin, gingerols and shogols can also neutralize free radicals, so they protect cells from oxidative damage. Additionally, they also strengthen the activity of antioxidant enzymes like superoxide dismutase, catalase, and glutathione peroxidase. All this makes them powerful antioxidants. But why do they also have strong anti-inflammatory properties? Well, gingerols and shogols inhibit cyclooxygenase and lipoxygenase enzymes. These enzymes play key roles in the inflammatory pathway because they convert arachidonic acid into pro-inflammatory mediators. These pro-inflammatory mediators then lead to bone and joint inflammation. To add ginger to your diet, simply boil fresh ginger slices in water for 10 to 15 minutes, then enjoy. So these were the top 10 natural remedies for bone and joint pain. Now we want to hear from you. Have you recently tried any of these natural remedies to relieve your bone and joint pain? Did you notice immediate improvement? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.